Massage and traction. So what is massage? It's the manipulation of superficial layers of muscle and connective tissue to enhance function and promote relaxation. Some indications for massage are decreased DOMS or delayed onset muscle soreness, decreased scar tissue, decreased edema and contusion, decreased muscle spasms, increased blood flow, loosen muscle and connective tissue, soothe and relax, and increase healing. Contraindications for massage are severe hyperesthesia, excuse me, the presence of foreign bodies, vascular disease, open wounds, cancer, tuberculosis in the area, infection, a fever, any unhealed fractures, and skin disorders or lesions. And severe hyperesthesia, which is something I'm having a problem saying, is just hypersensitivity. Some precautions for massage is you got to be careful. It may increase the inflammatory response, so you want to be careful when you're doing it on an acute injury, varicose veins, hemophilia, and gross edema. Physiological effects of massage: the movement of lymph, venous blood, hematoma, edema, muscle fibers, muscle mass, tendons, skin, scar tissue, and adhesions. The increase of blood flow increases nutrients, increases tissue temperatures, increases extensibility of connective tissue, and increases range of motion. It decreases delayed onset muscle soreness, muscle spasm, heart rate, and blood pressure. Some types of massage. The first is effleurage, which is a succession of light or deep gliding motions. So when you're doing a massage, most often you're going to start with the effleurage, and this is a good way to get the skin warmed up and the lubricant spread. It's also used a technique used to strip muscles for recovery. So you'll see when people are like in track after their heavy day of work, they'll get in and you really get in and really get down and deeply and really push out all those lactic acids or strip the muscles. It's also used at the beginning and at the end as a finishing technique. And it's good for a pre-workout massage to increase blood flow. Something I learned at working track is a lot of times before an athlete, the day of a race, just not even having them take their sweats off, just right over their sweats, just kind of rubbing the skin, getting it warmed up is real good to get those muscles loose and the blood flowing. Next is the petrissage, which is a kneading or rolling of the muscle. This is really good when you're trying to release muscle tension, just picking up those muscles or finding the trigger points and really pressing on those. And it's also a good way to get the lactic acid out. And then tapement is a cupping or striking of the muscle. Again, this is increased muscle tension, increased blood flow. This is probably something more you'll do before a race. And like in a track athlete, maybe something right before they go out to get on the track. You kind of knead the muscles real lightly and just tap them and start getting those muscles ready to go. Another type is a friction massage, and this is usually deep and across the muscle, deep massage across tissue. This is really good for getting the fluid out of tendons when people have bad tendonitis and to break up scar tissue. Another thing what we'll use is traction. And so what is traction? That's the application of mechanical forces to the body in a way that separates and elongates the surrounding soft tissue. This can be done either manually or mechanically. It can use body weight or gravity, and it can be applied to the spine or even peripheral joints. So how it works is the traction pulls the vertebrae apart, increasing the space between the discs. There's an increase in interdiscal pressure that sucks back the protruding disc. So someone who has, if you think of someone with a bulging disc, they have a little tear in that inner disc, that tissue between the vertebrae, and so there's a little gel that's inside these discs, and when you have a little tear in that disc, some of that gel kind of pops out, sort of like a jelly donut. And so the idea is when you pull traction, it'll suck that protrusion back in, And a lot of times when you have a protruding disc, you'll have the pain muscle spasm pain cycle. So you'll have pain created by the by the protruding disc, which will create muscle spasm, which creates more pain and creates more muscle spasm. So you're just trying to break that cycle and get that muscle to relax.